Hi, I'm Jocelyn Langholz. I'm a therapist at Behavioral Health, and I've been here for 19 years. I work primarily with youth and adults at this point in time, and today I'd like to share with you some breath practices and some work on mindfulness. I wanted to share with you today a little bit about being present, which has to do with what I'm going to share as a breath practice, and then maybe a little bit of movement. And then we're going to talk about mindfulness. And the breath is one way to become more present, which is an important aspect of mindfulness, and I'll be explaining the rest of some of what you can do with mindfulness as we go along. Just be sure that you feel grounded, connected to what's beneath you. So if you're in your chair, notice the chair, the back of the chair. Notice your sit bones. Notice those points of contact. Perhaps if you're seated, you'll notice your feet on the floor as well. Whatever you notice in terms of contact with what's below you or behind you, just notice that for a moment. And then I'm going to invite you, if you wish, to bring your hand to your chest and perhaps your second hand to your belly. So this is kind of grounding. This is like, I know where my body is now. And this will also give you a chance to follow your breath. And so when you're ready, you can keep your eyes open or you can close them. I tend to close mine. I invite you to take a nice deep breath in through your nose if possible, but not necessarily. Breathing in and pausing and breathing back out, all the way to the bottom of the breath. Perhaps as you're breathing, you notice the belly rising and falling. And as you continue to breathe, perhaps expanding the exhale even a little bit more. So inhaling and exhaling. And you can continue with that. Some people like to count as they breathe in and out, and that's an option. Sometimes that gives you one more thing to pay attention to. And if you do counting, I advise having double the count on the inhale or the exhale from the inhale. So you're inhaling for 3 perhaps, and exhaling for 6. So the idea that the exhale is much deeper, because that's where the relaxation actually comes in. That's where the shoulders drop. That's where your mind is like, okay, I can settle down for a moment. And if you enjoy that, you can continue. That's also a really good way to breathe if you want to lay on your back, on the floor or on your bed and breathe that way, just allowing the breath to move in and out slowly and deeply. So that's one way to breathe, especially if you're finding your brain especially busy or active. So this is called a sun breath. And so what you do with the sun breath is you bring your hands to your side, and as you inhale, you bring your arms up overhead, and then exhaling, you bring your hands down through the front to your heart. And then we can do that again, inhaling and exhaling. Inhaling and exhaling. So what we intend with that breath is to become a little more activated, and again, a little more present in the body. I feel that most of us at some point in our lives are dealing with some kind of challenge, some sort of trauma, some sort of disruption, some sort of difficulty that we need to recover from. And certainly some people are actively in a recovery process, whether from drugs or alcohol or from some trauma or some mental health challenge that we actually diagnose. But past that, all of us have things. All of us have stuff. And so I wanted today to be able to talk about, wherever you're at in that continuum, what are some of the resources and practices that you can use to move through the challenges that all of us are sharing at this point in time. It's really important for us to both identify where stress comes from and also where we can take care of ourselves. And so I see layers of that. I see stuff that's within ourselves, which is our mind, our emotions, and our bodies. There are relationships, with people we choose to be with and people that maybe we don't choose to be with, but we have to deal with. And then, of course, the environment, which could be as small as our home environment or our work environment, but as large as, the city, the state, the whole world. And so I think within all of those things, we can have stresses, but we can also find support and resources and opportunities. A big piece is about just mindfulness. And mindfulness has been kind of a popular approach thrown around in the last few years, but it basically means paying attention, being in the moment and noticing what's going on both around you and within you. And so noticing not just what's going on outside of you, but also how am I feeling about this? How am I thinking about this? And how do those things interact with each other? And so being able to pause and notice then gives you opportunity to take action, whether that be internally in terms of self-care or physically in terms of self-care, or something out in the world that's going to make you feel like you're making a difference or you're managing or you're helping. There are things we just have to have in front of us and have to deal with. Okay, that doesn't mean we're cool with it or we're not going to do anything about it, but it does give us then room to say, okay, what are my options now? Well, my first option is to be present. And if it's too anxiety-producing to be present, are there ways I can take space? You know, do I mentally distract? Do I go play video games for an hour? That's fine if that's what you need to do because you don't have the ability to deal with the thing in front of you. We don't want you to stay playing video games forever because then you can't do the meaningful activities, you can't engage, which is also important. But if you need to disengage, bottom line, disengaging is okay. You can take a nap if you need to disengage. I encourage people to be really intentional about how you do that then. So it's not just shutting down and hiding. It's how can I take the best, most cozy, refreshing nap of all time? Where's my favorite blankie? Where's my favorite spot? I need my dog to come with me? So that's different than I just can't get out of bed. I can't move. So I think those sorts of mindfulness opportunities to assess, here's my situation, what do I need to skillfully respond to it, is a huge piece of coping. For moms in particular, I think one of the really important answers is you're going to be a better mom if you take care of yourself. So you need to be selfish, even if it's just because you want to be a better mom. So I don't think those two things are incompatible, and I think sometimes women in particular get caught up in the I just have to give, I just have to give, I just have to go. And you're not going to do as well with your go, go, go if you're not pausing. We have to balance that self-nurture I was just talking about with challenge. There are times, especially when you're a mom, but other situations as well, there are times where you do have to suck it up. And when you consciously know you need to do that, do that. Knowing that when you're done sucking it up, you can go back to nurture. So there's that balancing between challenge and nurture. There's appropriate times for both. Our bodies and our minds are so connected to each other. And so it's really important to pay attention to things like what am I putting in my body, whether it's about are you drinking enough water? Are you exercising? Are you moving? Are you going outside and breathing fresh air? Because our bodies and our minds are so connected that we need to nurture the body for mental wellness. And we also know that if we are under chronic stress, there are all sorts of physical ailments that occur because we're not taking care of our mental health. When I think about Recovery Month, that's a piece that for me is just really important for all of us to remember is we all have stuff. You know, some of our stuff is more blatant. Some of our stuff is more urgent in terms of safety and wellness and all of that. Like, yeah, I want you to be safe first, and then we'll get to the other things. When I take all the pieces back about what is wellness is about balance. Because balance isn't this. Balance isn't a rigid, this is how we're going to do it from now on. It's, you know, can I move between those two things, knowing that they're both important.